Hello, Dr. Shabbir. It is very nice to having you here to discuss about your role in the iHelp project. Do you want to tell us some things about it?
Thank you for having me here. I myself, Professor Shabbir Syed-Abdul from Taipei Medical University, Graduate Institute of Biomedical Informatics. We are really so happy to get involved in this project, which is ultimately focusing on long-term care of the patients and how we can do telemonitoring of the patients at their home and improving the quality of life. That is exactly what we are focusing on.
Mm-hmm. So, many advocate remote healthcare that grew in popularity during COVID is here to stay in the post-COVID era. What do you think?
Definitely yes, but before jumping into the project, I would like to introduce a concept where we are following in Taipei Medical University, that is 4P medicines, which is prediction, prevention, participation and personalization. Because this is the key route for us for better and improved care for our patients. So coming back to your question, yes, after COVID, our lives have changed so much, and in every field, health field also embracing information technology. We don't want patients to have unnecessary visits to the hospitals, and at the same time we don't want to neglect their own conditions such as chronic conditions like cancers, chronic kidney disease. So we need to have a strong and proven tool of telemonitoring, or we call as a home care solutions.
Definitely our lives have changed in a great extent. Do technologies like Healthencia from Innovation Sprint facilitate the clinical side?
Yes, indeed. But before going with the solution, again, I want to emphasize on the problem, because the current problem here we want to focus is how I can take care of my patients when they are at home and they don't want to visit as often as they used to do before. And I don't want them to develop some complications, then come to me, then I start treating. Therefore, we need a tool such as Healthencia, which help us to keep record of day-to-day lifestyle activity, behavior of the patients or the users, and it tells us about physical activity, it tells about sleep behavior, it gives you heart rate variability, and we can do lot of the analytics using this type of data, and we can give prompt service for our patients.
Okay, so you suggest the combination of using such applications and contacting with the clinician.
Indeed, actually a wearable device plays a very good role when we combine wearable device with the Healthencia, because it gives you a dashboard on your mobile phone how you were sleeping, not today
with important data.
Exactly. And also the record of the data. It's not only one cross section of the data, how you were sleeping 1 month before, 6 months before, same things with your physical activity.
Traceability.
Exactly. This will give us to understand the health status of our patients.
Very nice. And are the clinicians ready to embrace home care or telemonitoring?
Indeed, yes. If you were asking this question before COVID, 2 years from now, I might have hesitated to answer this.
Yes.
But now, without even thinking, I can say yes, because IT is booming in different fields, not only in healthcare, and healthcare is not behind that. Now you can see everyone wants to get connected and use technology, and now, as I told, we want to use technology for the telemonitoring and observation of the patients at their home and tracking of their lifestyle.
And in my opinion, even if they are not ready yet, they are willing now to have an experience with these
Definitely yes. Obviously
methods, yes.
Any technology will take some time for adoption,
Yeah.
but this pandemic was a catalyst which has fastened the adoption of technology in our lives. So healthcare is not behind now.
Okay. And in your opinion, what are the most important needs of home care?
As I told, the most important needs of home care is number one, patient engagement. Because obviously it doesn't matter what you are giving to patient, if they are not using it, then you can't do anything with that. So patient engagement, patient empowerment. Patient empowerment comes by giving timely information to the patient, and this information we are collecting from the patient themselves. By help of wearable device, we can see how much they are physically active, we can see their quality of life, quality of sleep while in the night, and we can also see how much they are active, networking. All those things can be monitored by the wearable device, and that will be connected to the apps like Health Ancia,
yes.
and we use AI models to make meaningful inferences of the data collected.
Okay, I'm glad you mentioned wearable devices because I want to explain us how can artificial intelligence and wearable devices contribute to home health care.
This is very interesting because, see, wearable devices is for the purpose of collecting data, but if you have so much data and you don't have proper tool to make analysis, and that analysis should be timely. You cannot do analysis after 1 month or 2 months collecting whole data. That will not be useful for the patient. So now we are not only talking about AI, but we are talking about edge AI. That means we make a models and keep these models back into the sensors in the devices, so that the devices will give reaction to your activities. For an example, if you sit longer than 1 hour, your watch will buzz and ask you to stand up and stretch.
To motivate me. Yes.
Exactly. How that's possible? Because the data collected during this 1 hour will be analyzed by the edge AI, which is in your mobile device, and it gives a trigger to, okay, you are not moving so much, so you need to stretch. In the same way, it tells you the quality of your sleep, not for only last night, but for record of last few months also. In that way, they compensate to each other.
Okay. Thank you, Dr. Shabbir. It was very nice to meet you here and discuss these important topics.
Thank you so much, and I think iHelp is definitely helping us getting back to achieving our goal of telemonitoring and taking care of patients. So therefore, we are very glad to be part of this consortium. Thank you.
Absolutely. Thank you.